Hi, today I'll be discussing the Wigger's diagram. I'll break it down in such a way that within 20 seconds you'll be able to locate the probable cause of abnormality. So now let's get started. On our x-axis we have our time, and on the y-axis we have our volume and pressure. Let us first address the pressure curves. So we have three lines here. We have the atrial pressure. The atrial pressure will usually range from 0 to 15 mmHg throughout the cardiac cycle, that you can see in this picture. And then we have the ventricular pressure, which ranges from 0 to 120 mmHg as seen in the blue curve. And the aortic pressure represented in red, which fluctuates between 80 mm to 120 mmHg. Now let's look at all three pressure curves together. The first phase is that of atrial systole or the ventricular diastole. That means atria are contracting, ventricles are relaxing, which is evident in their pressure changes. The atrial pressure is rising, ventricular pressure is fairly stable. Now, once the ventricles get filled with blood, the pressure in the ventricle starts rising, and your AV valve or the mitral valve will close. Moment this closes, ventricular pressure will rise sharply, represented by the steep curve. And once this pressure exceeds the 80 mmHg, that is the systolic pressure of aorta, the aortic valves will open. Now this is followed by rapid increase in pressure, which is a phase of rapid ejection. And then there is a phase of reduced ejection, where we'll see a slight pressure decline in the ventricular pressure. And when this ventricular pressure falls below 80 mmHg, your aortic valve will close. Now notice in the graph you see a very peculiar thing, that once the aortic valve closes, your aortic pressure tends to increase. This is due to your elasticity of the artery, and this feature is known as dicrotic notch. It is the marker of the end of the systole phase. The ventricular pressure continues to drop, and eventually it falls below the atrial pressure, and your mitral valve or the AV valves will open. Moving on to the other curve on the y-axis, that's your ventricular volume in milliliters. Now, as we know, during the beginning of cardiac cycle, when both atria and ventricles are relaxed, there's a certain amount of blood already present in the ventricle. So that's why we are starting from a value of roughly 100. And then when atria contract during atrial systole, you can see the volume continues to increase. Now, moment your AV valves or mitral valves close, both valves are closed. So this is a phase of isovolumetric contraction as shown in the diagram. And this volume of blood, which is present at the end of diastole, is known as end diastolic volume. Now, moment your aortic valves will open, blood will rush from ventricles into the aorta, which is represented by this downward slope, and this is also known as the stroke volume. Once again, once the aortic valves close and your mitral valve is closed, the volume is fixed. It is represented by this flat line. This also represents your end systolic volume, and this phase out here is a phase of isovolumetric relaxation. And after this phase, once again, the ventricular volumes will start rising. Now let's look at the ECG. The electricity will always come before the muscle. So your P wave will be present right before your atrial systole, QRS complex before the ventricular systole, and your T wave is present right before the ventricular repolarization, or just when the ventricles start relaxing. The heart sounds you can easily corroborate. Your first heart sound, or S1, is when the mitral valves close, and the second heart sound is when the aortic valves will close. Now let us jump into your clinical scenario. We have this graph with us of a patient, and you see this and you immediately know that ventricular pressure is a problem. It's greater than 120 mmHg. Now, remember, the problem is in the ventricular pressure, so usually the pathology will be in which valve? It will be in the aortic valve. Now, there can be two things. Either there will be a pressure gradient between the peak of ventricular pressure and the aortic pressure. That means your aortic pressure is normal, but the ventricular pressure is much higher. Now, why do you think that is going to happen? Because there is some kind of obstruction which is not allowing the blood to move from ventricles into the aorta, and the condition is aortic stenosis. That's one situation. However, if the ventricular pressure is high, but there is no pressure gradient, that means both aortic pressure is also high, there is no pressure gradient, then what do you think is the scenario? That means there is some amount of regurgitation of blood which is happening into the ventricles from the aorta, which is usually seen in cases of aortic insufficiency. Scenario 2 will be your atrial pressure is higher than 15 mmHg. Now, in the atrial pressure is higher than 15 mmHg, the pathology will obviously be in the mitral valve. See, the pathology will be always there in the valve, which is from where the blood is leaving the chamber. Now, once again, if now we again see the atrial pressure, if it is greater than 15 mmHg during your diastolic phase as seen in this diagram, that means there is a obstruction in the mitral valve or mitral stenosis. However, if the atrial pressure is greater during the systolic phase, so that implies that there is some amount of regurgitation happening from the ventricles into the atrium, and it's usually seen in mitral valve insufficiency. So here's your graph, and time yourself and see if within 20 seconds you can identify the pathology in this graph. I hope this video was helpful. Thank you.